Hey guys, let's learn about the brachial plexus today. So, plexus literally means a network of nerves, and brachial in anatomy relates to the upper limb. So, when I say brachial plexus, I'm referring to the network of nerves which are going to supply the upper limb. Now, there are five roots which mainly make up the brachial plexus, that is C5, C6, C7, C8, and T1. When the plexus receives additional supply from C4, then it is called as a prefixed plexus, and when it receives additional supply from T2, then it is called as a postfixed plexus. Now, these roots will join to form the trunks of the brachial plexus. The roots C5 and C6 will join to form the upper trunk of the brachial plexus. The root C7 will form the middle trunk of the brachial plexus, and root C8 and T1 will join to form the lower trunk of the brachial plexus. Now, the trunks of the brachial plexus are located in the neck between the two muscles, scalenus anterior and scalenus medius, and they carry a sheath of the prevertebral fascia along with them, which is called as the axillary sheath. The trunks will then further divide into ventral and dorsal divisions. This upper trunk, as we can see, is dividing into a ventral division and a dorsal division. Likewise, the middle trunk is dividing into a ventral division and a dorsal division, and the lower trunk is divided into a ventral division and a dorsal division. Now, these divisions will join to form cords. The lateral cord of the brachial plexus is formed by the joining of the ventral divisions of the upper and middle trunks of the brachial plexus. The posterior cord of the brachial plexus is formed by the joining of the dorsal divisions of all three trunks of the brachial plexus, whereas the medial cord is formed by the joining of the lower trunk of the brachial plexus. Now, the names of these cords, lateral cord, posterior cord, and medial cord, is like this because of their relation with the axillary artery. So this cord is lateral to the axillary artery. This is posterior located to the second part of the axillary artery, and this is also medially located to the axillary artery. Now moving on to the branches of the brachial plexus. Firstly, let's look at the branches which are given off in the roots of the brachial plexus. The major branch that is given off by the roots is the long thoracic nerves. The long thoracic nerve is formed by the root value C5, C6, and C7, and this nerve majorly supplies the muscle serratus anterior. The dorsal scapular nerve is given off by the root C5, and it supplies two muscles, that is rhomboid minor and rhomboid major. C5 also gives a branch to the phrenic, which will supply the diaphragm. Some other muscular branches are given off by C6, C7, and C8, which will supply additional muscles such as the longus colli and the scalene muscles. Moving on to the branches of the trunks of the brachial plexus, only the upper trunk will give rise to branches, that is, the suprascapular nerve and the nerve subclavius. The nerve subclavius, as the name implies, will supply the subclavius muscle. The suprascapular nerve will supply two muscles, that is, supraspinatus and the infraspinatus muscle. Both the nerves have a root value of C5 and C6 because, as we know, they're arising from the upper trunk of the brachial plexus. So if you trace them back, you can see the root value is only this, C5 and C6. Now moving on to the branches of the cords. First, I'll go through the branches in the lateral cord. The lateral cord will first give a branch that is called as the lateral pectoral nerve. The lateral pectoral nerve has a root value of C5, C6, and C7, and it's involved in supplying two muscles, that is pectoralis major and pectoralis minor. The musculocutaneous nerve will supply the muscles of the front of the arm, that is, biceps brachii, brachialis, and coracobrachialis. And this root value are C5, C6, and C7. It also continues as the lateral root of the median nerve, which will join with the medial root of the median nerve, which is given off by the medial cord to form the median nerve. The median nerve will supply the muscles in the front of the forearm. Moving on to the branches in the medial cord of the brachial plexus. First, you have the medial pectoral nerve, which, like the lateral pectoral nerve, will supply the pectoralis major and pectoralis minor muscles. And this nerve has a root value of C5 and T8. Next, you have the medial cutaneous nerve of arm and medial cutaneous nerve of forearm. Now, these two nerves are cutaneous nerves which supply the arm and forearm respectively, and the root values are same as that of the medial pectoral nerve, which is C8 and T1. Moving on, you have the ulnar nerve, which is basically how the medial cord of brachial plexus will continue. It continues as the ulnar nerve. The ulnar nerve receives a communicating branch from the lateral cord of the brachial plexus. Hence, it has a root value of C7, C8, and T1. Now, the ulnar nerve majorly supplies most of the muscles of the palm. Specifically, it supplies 15 muscles of the palm, and it supplies 1.5 muscles of the front of the forearm, which you'll learn when you study those chapters respectively. Moving on to the branches of the posterior cord of the brachial plexus, you have the upper subscapular nerve, you have the nerve to latissimus dorsi, lower subscapular nerve, and axillary nerve. Now, the root values of upper subscapular nerve, lower subscapular nerve, and axillary nerve are the same. That is, it is C5 and C6, whereas the nerve to latissimus dorsi root value is different. That is C6, C7, and C8. Now, upper subscapular nerve majorly supplies the muscle subscapularis. The nerve to latissimus dorsi will supply the very large muscle that is latissimus dorsi. Lower subscapular nerve will supplement the supply to subscapularis along with the upper subscapular nerve, but it also supplies the teres major muscle. The axillary nerve will supply a major muscle in the shoulder, that is the deltoid muscle, and along with that, it will supply the teres minor muscle. The posterior cord of the brachial plexus will continue as the radial nerve, which is the thickest branch of the brachial plexus. The radial nerve supplies the three heads of the triceps brachii and almost all the muscles in the back of the forearm. So this completes the study of the roots, the trunks, the divisions, the cords, and the branches of the brachial plexus. Now, moving on to the clinical anatomy, which is related to the brachial plexus. The first clinical anatomy that we're going to study is about Erb's paralysis. Um, so there's a point on the upper trunk of the brachial plexus called as the Erb's point. Erb's point is a point where 6 nerves will meet, that is the roots of C5 and C6, the suprascapular nerve, and the nerve to subclavius, and the anterior division or the ventral division and the dorsal division. Now, if I were to show you the point in this diagram, this would be referred to as Erb's point. Paralysis, injury to the Erb's point leads to the paralysis known as Erb's paralysis. When does this occur? So in order for this point to get injured, there needs to be undue separation of the head from the shoulder. And this can occur during difficult childbirth or when someone falls on the shoulder, or it can also occur when anesthesia is given. So the muscles which are seen to be paralyzed in this condition are the biceps brachii, the deltoid, brachialis, and brachioradialis. And sometimes it's seen that the supraspinatus, infraspinatus, and the supinator muscles are partly paralyzed. The deformity of Erb's paralysis can be studied with this figure. So the deformity of the arm firstly. So we can see that the arm is near right next to the trunk of the body, trunk. So the arm is adducted and it is medially rotated, whereas the forearm is extended and it is pronated. So this deformity as a whole is also called as the policeman's tip hand. And in this, the movements of the arm which are lost is the abduction and lateral rotation of the arm and flexion and supination of the forearm. It's also seen that the biceps and the supinator jerks are lost. Another important clinical anatomy related to the brachial plexus is Klumpke's palsy. So the site of injury in this is the lower trunk of the brachial plexus. So if I were to show you here, so we have a injury in the lower trunk of the brachial plexus. The cause of injury is due to abduction, undue abduction of the arm, such as when someone clutches something with the hand after fall from a height, or this can also occur in a birth injury. Now, since the injury is to the lower trunk of the brachial plexus, the nerve roots involved in this condition is T1 mainly and partly C8. Now, C8 and T1, this forms the lower trunk, and the lower trunk will continue as the ulnar nerve as we studied in the brachial plexus. And the ulnar nerve mainly supplies the muscles in the palm, which is 15 muscles, and 1.5 muscles in the forearm. So when there's an injury at the lower trunk, we see that the muscles which are paralyzed is the intrinsic muscles of the hand and the ulnar flexors of the wrist and the fingers. So due to this, the deformity which is seen is mainly you see is claw hand. Now, why does this claw hand occur? There is hyperextension at the metacarpophalangeal joints and flexion at the interphalangeal joint, which will manifest clinically as a claw hand.